Hi, I am at the clinic with my mother-in-law, and she is just getting over knee surgery on her right knee. They're fixing to be in here in a few moments to take out her staples, and I thought you guys would like to see this procedure being done. So, in just a few moments, they should come in and do this procedure. Alright, till then. This here is a closer look of the staples in her knee. I counted the staples, and there's 32 approximately going down her knee. And as you see, they've been in there for over a week and beginning to heal. Over 2 weeks, over 2 weeks, and they are beginning to heal. Very, very dry skin off to the side, which is normal. Everything, the physician came in and said everything looks normal. So we're waiting on the nurse, who will be back in just a moment, to remove these staples. And this is going to be a treat, so I'm going to record every single bit of it so you guys can see how the procedure is done. Thank you, and I'll be right back.
And it may sting a little, hon. Anytime you want.
Okay, here we go. She's removing the staples.
And that one wants to hang up.
Doing very well. 2 out, 30 to go.
You tell me anytime you want to take a break, and we'll wait a minute. Some people are fine just going ahead and getting them all out. Some people tell me they need to take a little bit of a break, and we are glad to. That's not a problem.
Very good. Fascinating.
When they come out, these are coming out easy. That first one, you know, it bent. You'll have one that does that every now and then. Okay.
Yeah, we got just a few places on here. There's 2 places that's bleeding, but she's taking care of it. Very good job, nurse.
Sometimes you'll see it bleeding from the staple hole.
Mm-hmm.
Because the incision's nice and closed up. It looks really good. Now, this is an adhesive, little glue. And what we do is the incision's healed, but we're going to put these stair strips on it just as an extra precaution. If we make this one start bleeding. The stair strips will wear off. When they start getting frayed around the edges, you can trim them with some little scissors, but they'll come off on their own.
Okay.
And this is the adhesive, and all it does is keep the stair strips on. They're sticky too, but this kind of gives them a little extra help to stay on there for a little while.
Okay, so that was the adhesive, and this is the stair strips.
Mm-hmm. And you see, you can buy these in the drugstore. They're great. Like if you get a bad cut, it's just maybe a little big, but not enough to go to the hospital and get sewn up. Mm-hmm. These are wonderful.
There.
You're a good patient.
She is. She's wonderful.
They're going to let you come off the oxygen?
Mm-hmm.
Good.
Okay, and here we go for the second round. You can tell when they're really latched on there, where the skin starts to bleed a little bit. It's like, is it like to you one staple is in deeper than the other, or maybe it's just the healing?
I think it just has to do with the healing and how the staple comes out.
Okay.
There's no rhyme or reason to how they come out. Like some of them bend in the middle. Like that first one was a little harder to get out.
Right.
So you see Dr. Spear?
Mm-hmm.
You know Ann that works in his office?
Yes, I do.
Ann Garrett?
Uh-huh.
Well, her husband is my cousin.
Okay, well, Miss Ann and I are really good friends. I worked in pharmacy for about 9 years.
Oh, okay.
And I spoke to Ann on a daily basis.
Oh, she's such a sweetheart.
She is. I think a lot of her, and I can still call there even though I'm no longer working there, and call on her, and she gets me right through. So
that's one of the girls up here was trying to get a health spring referral on a patient and hadn't got it yet, and I said, I heard him talking, I said, call and ask for Ann. I said, because the nurses do them, and it may just be that they're real busy, but call Ann and she'll take care of it.
Yep.
And she did.
I love Miss Ann. And she even still knows that. I went in there with Dovie a while back, and Noah went in and picked up the regular prescriptions because she had moved to a different pharmacy. And she was in there. And she, hey Angie, how are you? I'm fine, how are you? She's real friendly.
Susie's still there?
I didn't see Susie. Tricia was there. Gabby was in the back, and they had some new girl that was up front.
Okay. Before I worked with Dr. Powell, I worked for Dr. Appel, and he went to Childersburg one day a week.
Okay.
Down in that office. And of course I knew Ann already because she's related, but saw the other girls down there one day a week. Miss Polly X-rayed. I think she retired.
A lot of them are getting on up there. I figure Miss Ann won't be long before she gets out of there.
I think you're right.
My ex-daughter-in-law used to work there and X-ray. She done the mammogram.
I think she's here at Brookwood
She's
now.
at Brookwood now.
Charlene Truck.
I don't know her.
She does the mammogram.
Yeah, she's
I don't know if she does anything else.
I was going to say, we were orthopedic, so I didn't say
Yeah.
that very often.
Now, there's not one buried under the skin right there.
Little scalp.
Okay.
Just a little scab.
All right.
Not that we don't miss one every now and then. We had a lady yesterday because hers, you couldn't see it. There was scab over it. And
yeah, that's what I was
and after a couple of days, she'd been showering and she saw it, so she came by and we took it out.
okay.
Most of the time, we get them all the first time.
Well, if she misses any, hon,
One more. No, you won't.
I can do it for you. All right, she's applying the adhesive, and she's just going to do the sterile strip. We have a really good patient here.
She is a wonderful patient.
And now she's ready to run a marathon.
I'm going to get my other knee done, but I'm going to give this some time to get really healed.
That's a good idea.
Yeah.
I don't want to have to
you know,
Your body needs
pressure on this one
Yeah.
to help take care of this one.
Well, and your body needs to recover. Because this is a big surgery and you lose some blood and you just need to recover in general after having an operation like this.
I think I've lost weight, but that's a good thing. I did not have an appetite after surgery.
A lot of people don't.
So hard for me to eat anything. When you're not hungry and you just don't want, it's hard to make yourself eat.
Yeah, it is.
well, this is the outcome of it. Look how great a job she did. This is the nurse.
Hi, I'm Kathy.
And this is the patient.
Hi, I'm Dovie.
And this is me. Hi, I'm Angela. And this is the end of our video. Thank you.
You want